Hello everyone. In this video, we're going to study another pathological pathogen, static blood. Static blood refers to a pathological product of the stagnation of blood flow, including blood stasis in the meridians, 脏腑 organs, and the blood outside the vessels. So from the definition, we will see that static blood is not only referred to the blood outside the vessels, which might be the bleeding. We also include the poor circulation, which is, or in other words, stagnation of blood flow. So if the flow of the blood, they flows less than it's supposed to flow the speed, we also consider as static blood. And here the blood stasis refers to the pathological status due to the poor blood flow or blood stagnation. So these two words, you need to understand these two words are different. Blood stasis refers to the pathological status. So the static blood is the cause of blood stasis. One is the result, one is the cause. And then what's the formation of static blood? The first is bleeding. As you can see from the first picture on the skin, the bruise there, the darker color on the skin, that's the bleeding under the skin. That's the bleeding. These we call the static blood. The bleeding can be bleeding out of skin, which we can see the blood, such as after injury or after cut, you can see the blood, or the bleeding under the skin. You can see the bruise, but you don't see the blood on top of the skin. So the first is the bleeding. The second is the qi stagnation. Qi stagnation is also very easy to understand. The reason why qi stagnation will cause static blood is because the qi, the relationship between the qi and blood. When we studied previously, when we discussed the essence, qi and blood, in that session, we said the blood is the vehicle or the carrier of qi. Qi is the commander of the blood. So the blood flow or the circulation of the blood, the proper or the good circulation of the blood relies on the good circulation of qi. Because blood is physical, we can see, which is yin. Yin need to move. We need some yang qi to move. So if the qi doesn't move well, it will result in poor blood circulation, which in other words is qi stagnation. So qi stagnation can cause static blood deficiency. The first cause is deficiency. It can either be qi deficiency or blood deficiency. These two is actually different. Qi stagnation and qi deficiency, they can happen to take together. They can be the combination of both. But for qi deficiency, one, for qi stagnation, that the qi doesn't move properly. Qi deficiency means that qi doesn't have enough force to move. So qi stagnation can be the result of qi deficiency, and also the causes of qi stagnation can be other causes. apart from qi stagnation. So when the qi doesn't have enough force to move the blood, it also will cause static blood because the flow will slow down. The fourth one is the cold condition of blood. The cold condition of blood, then you need to think about what's the characteristics of coldness. When we talk about the 6 exogenous pathogens, the characteristics of coldness of the blood, it will slow down the circulation. This is very similar if you put the body in a fridge or even a freezer. All the climate is the weather is colder. Then some people they can feel that cold feet and cold hands. Why they have these kinds of symptoms? Why they were experiencing coldness in the hands or feet. That's because of the poor circulation in the extremities due to the cold condition. And these, in other words, you also call the static blood due to the coldness because the flow slowed down. The last cause of the static blood is the heat condition of blood. So now you don't be confused. The cold condition of the blood can cause the static blood, and the heat condition also can cause static blood. The reason why the heat condition can cause static blood is it's very similar. The heat condition, the hot condition, or the fire in the body is very similar if you cook the fire. Similar when you cook your soup at home. When you use the fire to cook the water will be concentrated. And then once the water concentrates, the volume of the water in your pot will be less. So in this condition, in the body, when you got excess heat, the heat will concentrate the blood, and then the result of this concentration is blood becomes thicker. Once the blood becomes thicker, it doesn't move that well. Then that will result in static blood. So these are the main causes or the main formation of the static blood. Where does the blood come from? The other formation or the other possible causes also might be like deficiency of body fluid, because in that condition in the body we don't have enough water, or injury that's also related to the bleeding, phlegm, or improper treatment. So these are all the possible causes of static blood. And next we're going to discuss about the characteristic of static blood. It is very important that we know these characteristics, because only you will know, you understand these characteristics, you can conclude that the blood, you can figure out the pathogens. When we study these pathogens, it's very similar. If I ask you to remember someone or one person, such as I ask you to find me in a group of people. So how do you find me? If you don't know me, obviously you won't be able to find me. But the other way you find me is I can show you a picture of mine, and then you will know, once you saw the picture of me, and then you can see in a group of people which one is me. That's what we are going to do in our diagnostics. We're going to show you a lot of pictures from the clinics. Then you will, if you remember those pictures, you will figure out what kind of problem the patient you were seeing now. In the other way, if I want to tell you this, if I want you to find me from a group of people, I can give you some descriptions of myself, of my physical body. Then it's easier for you to find me from a group of people. And then these characteristics of the pathogens we study now is the descriptions of these pathogens. So the characteristic, the first one is the static blood can affect the qi flow or qi movements. This is very similar to the phlegm because the static blood is also a physical object and obstructs the meridian, the flow, the pathways. So it depends on where. It also can cause different symptoms, such as the meridian. It can cause numbness or even impairments of the physical movements. The static blood also will adjust the blood circulation. That's because these two, the blood circulation and qi flow, are actually very similar because the blood circulation depends on qi flow. Okay. Then the next one is quite important, the objections of formation of new blood. So in Chinese medicine theories, wherever there's a static blood, the new blood will never formated. The reason why is because the space was occupied by the static blood, so the new blood have no space to come in. That's why for this kind of treatment, sometimes, especially in some acupuncture treatments, we use 3H needles to prick the static blood area. It causes bleeding. Once the static blood comes out of the body, the new blood will form in the area, which can help the recovery. Static blood also can cause different kinds of diseases and symptoms, but most important here is the static blood always have a fixed location. So this is very different from the phlegm. The phlegm can be anywhere. You also can move, but for static blood, you always stay at one area. You won't change. You also can have different symptoms due to different area, such as if the static blood in the heart, it can cause chest pain. If the static blood in the lung, it can cause difficult breathing or coughing blood. If the static blood in the liver, it can cause irregular menstruation or some gynecology problems. If the static blood in the brain, the stroke. So it can be in different areas, but it will be a fixed location. If someone got stroke, that's the static blastasis in the brain, and this blastasis or this static blood will normally will not move to any other area. So that's the fixed location. And also the the symptoms of static blood, it can be pain. This kind of pain, it's a kind of stabbing pain, and stabbing pain also a fixed area. Normally it won't move, and you will be aggravated by touching or pressing. Aggravated by touching or pressing. This kind of pain also may be worse in the evening. So if someone tells you that they got the leg pain, although you don't see the bruise, the patient has no sign of injury or previous injury, but the patient tells you that the pain aggravates at night. Then you will see that it might from static blood. It also might from others, but that's because this is one characteristic of the static blood. Swollen. So swollen also another sign of blood, of static blood. Bleeding. And bleeding you can see very obviously, and also from the color, purple or dark color. That's the picture in the previous video, in the previous slides, the darker color. And from some pulse, different kinds of, when we study the pulse diagnosis, you also will find the static blood from the pulse, because the circulation of our blood and qi in the body, when it changes, the pulse, the feeding of the pulse also changes. So when we study the static blood, what's important here is the typical symptoms of static blood is a fixed location and stabbing pain. So it doesn't matter where it was affected, such as someone got headache. If they feel that kind of headache is like stabbing pain, then we think that's static blood. If the pain in the stomach ache, but this kind of stomach ache is also a kind of stabbing pain, then we also think that's static blood, due to static blood. So that's how we diagnose according to the symptoms, and then we can trace back to the causes. The common symptoms of static blood: pain, swelling, masses, bleeding, dark color, irregular pulse. Irregular pulse can refer to many different kinds of pulse. We're going to introduce in the diagnosis. On the tongue, so the dark color came from the skin, can see from the lips, can see from our nails. Also, we can see from the tongues. For these, the tongue diagnosis and the pulse diagnosis, because it's very typical, we're going to introduce separately. There's another pathological product, stone. Stone refers to the pathological product of stones. So for this pathogens, it's very obvious it is stones in the body. And then this categories of stones is actually quite simple. The formation of stones can be improper diet, it can be emotion problems, improper medication, also body constitution. So for here, some diets, if you eat something together, it might easier to cause stones, or the emotion which will obstruct the qi and blood flow, and then can slow down the circulation, which can form the physical objects, which causes stone as well. Body constitution. Some body constitution are more easily to have stones. And then the stones mostly happens in liver, kidney, gallbladder, stomach, and bladder. So these are the organs that mostly happens in these organs. The cause of the diseases, most of the cause of diseases are quite long, and the stones can obstruct the qi flow, damaging the vessels and meridians. So it depends on the situation. If the stones there, they stay in the organs, there's no pain. But once, especially for acute attack for the stones, the typical symptoms is sharp pain, also referral pain, such as the stone in the kidney or bladder can cause blood in urine. Also, how severe the stone, these pathogens will affect our body. Also depends on the size. Most common happens in clinic is the gallbladder stone and also the bladder stone. Gallbladder stones patient can experience no symptoms. They also can have pain in upper abdomen. Some severe condition patient may have jaundice. And for the stone in the bladder, small kidney stone or bladder stone, you also have no symptoms. And once the stone block obstructs the tube, you can cause pain, sharp pain, referral pain. Also can cause blood in the urine or difficult urination. So from the pathological products, we have introduced 3 pathogens, which are phlegm, static blood, and stone. For these 3, the previous 2 are more important to understand, especially for phlegm and static blood, because these are most common pathogens affect our health, especially for internal causes. Except the exogenous pathogens, for internal causes, these 2 are quite important, and these 2 are actually the results of other pathogens. So it always happens as the combination of the other pathogens. That's why they have variety of different symptoms. It can show as variety of different symptoms. Next, we're going to talk about the miscellaneous pathogens. Miscellaneous pathogens, there are many different causes of these pathogens, such as trauma, force, injury from force, such as accidents or car accidents, those physical external force, or burnt, frostbite, animal bites. So these are miscellaneous pathogens. Also, the parasites can be the pathogens. The parasites, especially the parasite itself, those cells can be the pathogens. Also, the parasite, the eggs of the parasites also can cause similar symptoms as the stones. So the parasites when we study the herbal medicine, we will discuss more for specific herbal medicine for specific parasites. The picture there is a picture of a round wound. The next, congenital factors. Congenital factors actually quite complicated, and this is due to the congenital problem which from your parents. So this is very similar to the innate factors. The reason why we use innate essence, innate qi, is because they are healthy, they are physiological, and then we use congenital as the pathological condition. So for these congenital factors, if it depends on the parents, for instance, some diseases can pass on from your parents. Some babies, they were born with diseases, and this kind of diseases we call congenital factors. What can affect congenital factors? It can be the parents' age. It can be the parents' body constitution. Also, it can be the parents, their health. For example, such as here in South Africa, we got a lot of HIV patients, and then some HIV parents can pass on the virus to the kids. Or this is considered as congenital factors. So for congenital factors, it's related to something from parents. The other more common cases is if the parents have the kids very young, for instance, before 20 or even before 18, then the kids may be weaker, the kids' body constitution may be weaker. Or if their parents are old or have the kids in their senior age, such as over 40, over 45, then in this condition, the kids also may be weaker in terms of the body constitution. And these are also considered as congenital factors. The other aspects from the congenital factors are related to the habits of the mother during the conceiving process, such as their diet also can affect. If I saw two kids, one for inflammation, one for the skin disorder, one for asthma. These two babies born with the skin problem, inflammation, and on the skin, and the other one born with the asthma. But when I think about ask about the history, the conceiving history, the mother, both of the mothers would eat spicy food for the whole process, conceiving process. So in this condition, the spicy food is considered as hot food, and when we already have discussed the improper diet for this hot food, we accumulate the heat in the body, and this heat in the body may affect the baby during the conceiving period. That's why these two babies, when they were born, they born with these diseases, and this is actually the fire from the mother. That's also the congenital factors. That's exactly why during the conceiving period, the parents need to look after their lifestyle, their diet more in order to make the kids healthier, which we all want to do so. Miscellaneous pathogens also include improper medication. Improper medication may be from the doctor's fault, also may from the patient's fault. Overdose. Overdose. It depends on, especially some herbal medicine, some with toxic herbal medicine. We have very strict dose limits. If they exceed those limits, it can cause damage, and this damage you consider as the pathogens overdose. Also, improper process. So for herbal medicine, some herbal medicine we need to process in order to reduce the toxic. If they don't process well, it also will cause the toxic component to be higher than normal. And improper compatibility. This also refers to the herbal medicine more, because when we study herbal medicine, we will know that some herbs are not supposed to use together. But when you use together, it might cause side effects. That's also from the miscellaneous pathogens. Improper administration. These are more related to herbal medicine. Improper administration can refer to the way how we cook the herbal medicine, how we prepare. Also, it refers to some herbs should not be taken by a certain group of people or in a certain period of certain process, such as for pregnant women. Some herbal medicine should not be used, and some acupuncture points is forbidden on some patients in some period, such as the points at the low back and low abdomen. We don't use on pregnant patients. So these, if we misuse these herbs or the technique, such as needling techniques, it will cause these problems considered as miscellaneous pathogens. Miscellaneous pathogens will increase the toxicities of the herbs, which can result in the signs of poisoning. Most common mild situation is vomiting, diarrhea, or numbness feeling in the tongue. The improper behavior of doctors. This is refers to as a doctor, when we see patients, your behavior need to be professional, because your behavior sometimes will affect on patients. For instance, if some patients, especially for anxiety and worry, that kind of patient, if you are very rude and if they feel very careless to them, this will aggravate their problem, especially from the words, your speech, the words you speak from your mouth. You need to show you're gentle to the patient. It's also the first step to build the confidence to you, from the patient to you. So the confidence and the trust between your patient and you. The improper behaviors of doctors also will refer to that aspects for the very bad handwriting. As we all know, that the doctor's writing, no one understands the doctor's writing because the handwriting is very hard to recognize. So this is not something we should learn. We should write clearly because this will make it much easier for the pharmacist to prepare the medicine, either the herbs or the tablets, if you can do so, if you are allowed to do so under some regulations, to avoid the wrong medicine being distributed to the patient. So from the handwriting, the improper behavior of the doctors also need to be careful of the diagnosis, wrong diagnosis. That's also the fault from the doctors. The wrong diagnosis results in wrong medicine will cause diseases. Then in this condition, we consider as the wrong medicine as a pathogen. And this kind of behavior will affect the patient's diseases. The most common symptoms of these is that they feel angry, or it may aggravate the existing disease, especially for the handwriting. And if they prescribe if they dispense the wrong medicine, it may aggravate or cause the other problems. So these we are considered as pathogens as well. So until now, we have introduced the most common causes, pathogens, in the theories of the etiologies in Chinese medicine and acupuncture. In the next video, we're going to introduce the onset of diseases, but in the meantime, you just need to revise more about the etiology, and you need to think more whenever you study Chinese medicine and acupuncture. When you revise these, remember to think an image in your brain that's something matching the description on our theories, because this will help you to understand and remember more and easier. Thank you, guys.